Hi, friends. Good morning. Welcome to Wasabi, Walnut, What's Hurting My Tummy Wednesday. Lotek Health. Let ourselves translate expert knowledge with Brad Burns, your host. Episode lucky number 13, trece. So I want to say what's hurting my tummy is from laughing too hard for the past 3-4 days, really since like Wednesday. My tummy hurts. It's been going from my left upper quadrant over to my right upper quadrant, from my liver to my stomach and my spleen. Right now it's my spleen that hurts from laughing so hard. I can't stop. Things have been ridiculously awesome. Last night I had a patient who spoke only Spanish, which isn't that unusual. But this time, I really wanted to try to be bilingual. They say people who speak 3 languages are trilingual, people who speak 2 languages are bilingual, and people who speak 1 language are what's called American. And I'm tired of it. I like to speak it because putting myself in her situation or his situation, depending on where I am, what language I speak is my native language, I could feel just as out of place as he or she did. And that's right. I threw a little change up, just so you have no idea if it was a woman or a man or a Latinx. They don't know. We don't know. So here are a few ones just to toss in for fun. I always get a patient an incentive spirometer to help prevent pneumonia. So I was practicing explaining expandir los pulmones, pulmones, to preventir la pneumonia. I reach in and have her hold my hands. I say exprimir mi manos, or him, depending on, it doesn't matter who. I throw another rail. The best one was doing a heparin injection, which we give to anybody in the hospital, because apparently you get in the hospital and you have this amazingly high risk of having a blood clot just being in there. It's like you catch a blood clot. It's terrible. And explaining what that is a little different. I say coágulo de sangre, medicina. They're so kind, being nice to me and saying medicina, helping me through it, because it's hard. I'm a stupid American. I don't know how to speak 2 languages. I don't know how people operate at that speed. When I'd walk out of that room, I'd walk into the other patient's room who speak English and feel that hola, oh, that's right. Hey, how are you? Do you need anything? Are you hurting? Is there anything I can get you? You breathing okay? You stop feeling nauseated? It's so easy to jump back into it, but when I walk into her or his room, I'm gonna keep you guessing. Is it a he or a she? It's Latinx. It's Latinx for you, eh? I don't remember exactly how to talk. I introduce myself, el enferma or enfermero, la turno de noche, which is the night shift. That's the next one. I haven't memorized this yet, but it goes a little bit. It's something I say to every patient as I'm leaving, is cuando la enfermera del turno de día llega aquí, voy a decirle diré que te traigo aquí planear en el futuro. It's when day shift comes, when the day shift nurse gets here, I will tell him or her the plan going forward, or what brought you here and the plan going forward. But it's so fun to do this. It feels so rewarding. I was giggling as the nurse next to me at the desk was losing her in mind, because I wouldn't stop. I just like practicing, because you can't just read these words. You have to practice. You have coágulo de sangre, pequeño pecadura, sting, little sting, pequeño pecadura, pequeño pericia, or what is it? Pericio, P-E-L-L-I-Z-C-O. Don't know exactly how the word goes, but it's so fun. It's so fun. Vuelvo enseguida. Vuelvo enseguida. As though any Spanish speaking people are hearing this. Shut up! Speak English, motherfucker. Do you speak it? But that's what I say a lot. If I got to go back out and come back in, vuelvo enseguida. Fun stuff. Another one is you had some issues urinating and he was retaining. That's probably may have been hurting her tummy. When in the hospital, if you're retaining a bunch of fluid, we're trying to rehydrate you. This patient in particular had an issue where they got an infection, gave antibiotics, and just blasted her kidneys, vomited, diarrhea, so fluided her all the way out, super dehydrated. So we're giving her a bunch of fluid, or giving him a bunch of fluid. I don't judge. Latinx. That's what, like I said. And not able to urinate yet. So I'm explaining, mira el orinado. It's like, I'm going to look at your bladder, or look at your urinator. It's tricky. And then you got to navigate el tubo en el vejiga, orinado. Gonna put a tube in your bladder to help you pee. Who doesn't love to hear that? That sounds great. The next is deciding or discussing the tricky nitty details, which I didn't do with this patient, a little young. But it's never too young to talk about directivo anticipado, reanimación cardiopulmonar, ventilador, no ventilador, alimentación por sonda. Tube feeding, no tube feeding, ventilator, no ventilator. Oh, God. So, with that, I will say buenos dias. Give it a try, folks. I know this probably wasn't exactly translating expert knowledge. It was doubly translating. But these are our vulnerable populations, and they are agreeing to things that they don't know what they're agreeing to. So, with that being said, el pequeño picadura. Buenos dias. Gracias. Escucho. Me llamo Brad Burns. Love you guys.